This presentation is entitled Safety for Custodians. Note, the following is not meant as a legal interpretation of or a substitution for OSHA standards. Employee safety is very important to our company. As a custodial employee, it is your responsibility to follow safety procedures and adhere to company safety policies at each and every work location. This will keep you free from injury and help to reduce hazards. Proper workplace safety will prevent injuries to yourself and other employees and limit the number of accidents in our facilities. As an employer, we must meet certain legal requirements under the Occupational Safety and Health Administration, or OSHA, laws and enforcement. These are both state and federal laws, with certain required actions which include providing an injury and illness prevention program. We will provide training and any necessary personal protection equipment you might need to do your job. Regardless of your job position, safety at work is your personal responsibility, and that of each employee. As a custodian, it's important for you to identify and correct all hazards encountered in the workplace. This presentation is designed to help you effectively reduce accidents, prevent injuries and illnesses, and prevent fatalities on the job. This presentation addresses the requirements of OSHA and our company-required Injury and Illness Prevention Program. As previously stated, safety is the responsibility of all employees. To do your part as a company custodian, you must understand the potential risks and dangers within the workplace and how your personal actions in completing work tasks can affect safety of others or make you vulnerable to workplace injury. Prevention is a key principle of safe work practices. Many preventable accidents occur due to neglect in following safety precautions, ignoring or not understanding on-the-job dangers, employee carelessness. This presentation is intended to teach you how to complete cleaning and maintenance tasks while following procedures and policies designed to avoid or prevent fires, injuries, and accidents at work. Safe lifting. Frequent handling of materials can cause sprains and strains, especially when dealing with large, heavy objects and because of improper carrying or moving techniques. It's important to routinely stretch, strengthen, and warm up muscles before working at those tasks, and to follow safety steps and procedures. If you've been injured previously, undergone recent surgery, or have joint or muscle issues, you should consult your healthcare provider. So many back problems are caused by improper lifting, so listen closely to these lifting techniques. First, figure out whether you can lift the item safely. Before you even start to lift the box or object, take a few seconds to assess the situation. Look at the item. Decide where to grasp it. Should you pick it up from the bottom, or are there handles? Ensure the walkway is clear before you start carrying the item. Test the weight of the object to see how the weight is distributed and determine if you can carry it safely. You don't want to risk dropping the item. If you aren't sure you can lift the object safely, maybe it's too heavy or awkward, or the space is too cluttered to easily carry it where you need to take it, then don't lift the item. Avoid carrying anything that is too heavy or awkward. The potential for injury is just not worth it. Instead, you might want to get help or get equipment to help transport the load. Get another person and lift in unison while counting out loud. Or if the load is very heavy or awkward, use a tool like a dolly or forklift. Okay, so you've determined the item is safe to lift. Now we'll go into detail of the best lifting techniques. You may need to use gloves to protect your hands and improve your grip. Always make sure you have a firm footing on a level surface. Stay balanced. Lifting an object when you're unbalanced can cause serious disc injury. Straighten your back. And remember to use your arm, leg, and abdominal muscles to lift rather than your back. Don't bend at the waist and lift. Instead, you should squat slightly. Grip the object with both hands Slowly straighten your legs while keeping the load close to your body. Keep your head, shoulder, and hips in a straight line as you stand into an upright position. As you carry the item, keep your back straight and walk slowly. Do not twist your back. If you start to drop the item, don't reach for it as it falls. This can seriously injure your back. If you get tired while carrying the item, set it down in a safe place and take a short break. Keep the same ideas in mind when it's time to set the item down. Keep the weight on your arms and legs, not your back, and move slowly and smoothly. Don't bend or twist your back. Workplace ergonomics. Jobs that require repetitive motions can lead to injuries. Ergonomic design has become an element of many products and tools to reduce the strains and injuries caused by repetitive motions. Cleaning equipment, such as tool handles, vacuums, cleaning brushes, and accessories, have incorporated ergonomic features and design and decreased workplace risks. Custodial cart safety. How you operate and stock your cleaning cart can impact the risk of injuring yourself or others while on the job. Ergonomics and lifting safety come into play, as does the risk for accidents that can cause personal injury or injuries to other employees. Here are some safety tips as you prepare your cart for your cleaning tasks. Stock only the items you need for each area, if you're able to replenish often. Balance the cart load evenly, placing heavy items on the lower shelves. Equipment should not stick out over the edge of carts or obstruct your vision. Always ensure you have the required PPE and that cleaning solutions are properly labeled. When moving about the facility, always push carts using both hands and the back handles. Do not pull the cart behind you or use the side of the cart to move it. Pay attention to uneven or sloping surfaces and maintain a firm grip to avoid tipping it over or losing control. Move at a safe speed and take your time as you move the cart. Never push the cart against doors to open them, especially glass panels, which could shatter. Be aware of doors and the direction in which they open. Park your cart near walls, not against them, and never block doorways or passages with cleaning equipment. Here are a few thoughts about other cleaning techniques that involve proper ergonomics and safety techniques to reduce risk of injuries. High dusting. Always wear PPE to protect your face and eyes when high dusting. Stand at an angle, not directly under the area being cleaned, to avoid the dust and debris as it's falling toward the floor. Use a lightweight telescopic handle to decrease the strain of standing on your toes and reaching while cleaning. This will also reduce the need for ladder use. Switch hands frequently, but keep both on the handle. Take frequent breaks or alternate high dusting with other tasks to avoid strains and injuries. Keep your elbows close to your body while avoiding bending or twisting your wrists and hands. Mopping. When mopping, keep your back straight and choose lightweight equipment that will allow you to remain upright. Bend your knees, not your back. Hold the mop handle just below waist level with your dominant hand. Push and pull with that hand, using a horizontal figure-8 motion, steadying the mop with the other hand. Check your path frequently, moving backwards to avoid walking on the wet floor. Avoid extreme motions or twisting by cleaning small sections of the floor in a systematic pattern. Preparing and using mopping solutions. Using mop buckets requires proper lifting techniques when filling and emptying to avoid injuries and spills. Always use the smallest amount of cleaning solutions possible. Use a hose or a smaller bucket to fill a larger mop bucket. Keep your back straight, bend your knees, and keep the bucket close to your body as you lift it. Try to avoid twisting movements and bending at the waist. Keep arms and hands in positions that are not awkward, and rest your bucket on the edge of the sink, when emptying. Vacuuming. Always keep the vacuum aligned with your body. Avoid twisting. The vacuum cleaner should be adjusted to a comfortable height. Remember to alternate hands to avoid fatigue and repetitive motion. Remember to empty the vacuum bag often because a lighter vacuum is easier to use, does a better job, and decreases repair and replacement costs. Importance of personal protective equipment. PPE is essential to protecting custodial staff from workplace hazards, injuries, and accidents. Items include hard hats, safety goggles and glasses, noise-reducing headphones and earplugs, various types of gloves, protective footwear, brightly colored articles of clothing, aprons and vests, specialized helmets, and other equipment. Before performing job duties, have a clear understanding of PPE required for each task. Tell your supervisor if you have misplaced your PPE or if it is damaged. Do not operate equipment or machinery without sufficient training and authorization. Thoroughly understand pertinent safety procedures and policies. Remember to change gloves as needed to match the task and avoid cross-contamination. Hand and finger safety. Hand and finger injuries are common in the workplace. OSHA standards are specific on appropriate types of gloves and protection needed to protect workers' hands from a variety of hazards. Different gloves are designed for completing certain tasks and preventing exposure and injuries based on the chemicals and equipment used or other hazards. Be sure to use the gloves appropriate for each task. Some examples of proper glove selections are latex rubber gloves, are comfortable, expensive, general-purpose gloves. However, latex allergies may be an issue for some employees. Full protection from chemicals and solvents may be required using nitrile or other glove types. Kevlar and other cut protection gloves may be used when recycling materials and working with sharp tools. Fabric gloves provide protection from slivers, chafing, and abrasions in manufacturing. Coated fabric gloves are often used in laboratories for handling chemical containers. Removing contaminated gloves. Proper removal and disposal of gloves after use is sometimes overlooked in training and in practice on the job. To avoid injuries and contamination, always remove the first glove by grasping it with the opposite hand on the outside edge near the wrist. Pull away from the hand and peel off the entire glove while turning it inside out. The contaminated side will now be on the inside. Hold the removed glove in the still gloved hand while removing the second glove. By sliding an ungloved finger or two under the wrist of the gloved hand, peel the glove off while holding and bagging both used gloves together to be discarded safely in an appropriate waste container. Other safety tips for glove safety and to avoid injury or loss of fingers and hands are to carefully inspect gloves prior to each use for tears, punctures, discoloration, or other signs indicating they may be less than effective for protection. Discard and replace gloves as needed, especially those used to handle chemicals. Be aware of proper storage to prevent degradation and heat damage. Select the right size and fit. Loose gloves may become entangled in machinery or prevent ease of handling of objects and materials. Too small or tight gloves restrict movement and cause fatigue. Do not wear rings, bracelets, or other jewelry when operating machinery. Lastly, be sure to wash your hands as often as possible, especially if you are not wearing rubber gloves when cleaning. You can pick up germs as you handle chemicals and trash. Your personal safety is very important, and keeping clean will help keep you safe and prevent unwelcome sickness. PPE to prevent eye and face injuries. To meet OSHA requirements, Employers must take action to protect employees from hazards that include airborne particles, chemicals in gas or liquid form, and infectious materials. Eye protection must be worn when performing tasks that include cleaning tasks, chemical use, operation of machinery, work done overhead or when looking upward, recycling and trash disposal, replacing light bulbs, handling potentially infected materials and liquids. To fully protect the face and eyes from hazards, different requirements must be met, and the PPE must allow for movement while not restricting vision. Employees may not be able to wear corrective vision glasses when completing certain types of work. It's important for eye protection to fit properly and allow for a reasonable level of wearer comfort. 3 types of PPE used to prevent facial and eye injuries include safety glasses, similar to regular glasses but stronger, heat, and impact resistant. Safety goggles. These completely cover facial areas around the eyes to protect from splashes, particles, and impact. They may fit over corrective lenses. Safety spectacles. These are protective, impact-resistant lenses with metal or plastic safety frames. PPE and avoiding injuries while handling waste materials. Proper disposal techniques reduce contamination, cuts, and other injuries caused by improper waste handling. Many injuries are the result of carelessness and could be avoided by always using personal protective equipment, or PPE, like goggles and gloves. Understanding procedures, hazards, and proper disposal techniques. Never making direct contact between your hands and waste material. Never compacting trash that could contain sharp objects by using your hands. Not reaching into places you are unable to see into. Using proper lifting techniques, bending knees, and keeping the back straight. Carrying and dumping waste away from your body. Cleaning and disinfecting both insides and exteriors of trash receptacles. Safety information, slips, trips, and falling. Foot protection is important, and employees are all responsible for understanding the requirements for wearing protective footwear on the job. Proper shoes and boots decrease the potential for trips and slips, as well as foot and leg injuries. Never wear thin or heavily worn shoes, slick-soled footwear, open-toed shoes, and no-heel shoes at work. Non-slip steel-toed shoes or boots are required for employees operating heavy equipment, doing floor work, transporting materials and freight, or moving tables and boxes. Steel toes protect feet from objects that may fall or come in contact with your feet, while steel sole plates offer protection from punctures. Insulation helps protect employees' feet from the dangers of heat and cold at work. Tennis shoes are not appropriate or safe for working. Company dress code and safety policies will outline proper footwear for your position, as being properly shod can help prevent someone falling, from slipping or tripping on floor or other work surfaces. Custodial staff and all employees are expected to follow the required footwear guidelines when performing work tasks. Laces or fasteners on footwear must be correctly tied or secured, and PPE should be used as directed at all times. Shoes and boots should fit well and be comfortable. This improves safety for each employee by preventing fatigue-related slips or tripping. Always walk carefully in the workplace. Never run, as hurrying or walking too fast can increase the chance that an employee may trip, slip, and/or fall. Remember to keep to the right side of hallways and passages when moving within the workspaces, especially as you get near corners, and always use caution in opening doors. Floors and walkway hazards. While most workplace walkways and floors look safe, it's important to recognize that hazards do exist. Be aware of those areas containing certain hazards for falling that may be caused by trips or slips occurring as a result of uneven or low traction surfaces, slick or wet surfaces caused by moisture or oils, loose flooring materials, wrinkles in carpets or unanchored mats and throw rugs, dim lighting environments, objects or clutter left in walkways or on stairs, obstructed vision when transporting materials, thresholds and steps, distractions, noise using a cell phone, taking shortcuts or moving outside of safety-designated walking paths, moving too quickly, or running. As you complete your custodial duties, here are some important safety tips to follow to prevent accidents and injuries. Wet floor and other warning signs should be set up prior to beginning floor cleaning to prevent slips on wet or recently finished floors that may be slippery. When cleaning in corridors, allow a dry path to remain available by working on one half of the passage floor at a time. Wipe up excess fluids or spills from floors and walkways immediately. Once floors have been completely dried, warning signs should be promptly removed. Be alert to hazards like water leaks, damaged tiles, fraying carpet, or turned-up edges on any flooring. Report concerns or hazards noted to your supervisor to prevent future accidents. Preventative maintenance can also reduce potential fall hazards. Besides cleaning spills immediately when they occur, be sure to routinely clean and inspect equipment, drip pans, and other custodial tools which could be a source of spills. Following proper cleaning and safety procedures in custodial work and traffic areas is an effective means to avoid accidents and the creation of additional safety risks. Custodial staff members can reduce tripping risks in the workplace by clearing clutter, trash, or other obstructions from walking areas and steps immediately, maintaining safe areas for the delivery and temporary storage of packages or supplies, keeping an eye on flooring wear and tear and repair needs, maintaining lighting and promptly replacing bulbs and fixtures as needed, keeping power cords, cables, and hoses in designated areas away from walkways, properly storing and transporting cleaning equipment, adjusting your pace to an appropriate speed for the surface traveled and tasks to be completed, paying attention to where you're going and potential hazards within your path, using caution when carrying objects or materials that could obstruct your vision, being alert at corridor corners and when opening doors, not creating hazards for other employees as you complete your tasks. Climbing safety, stairs, ladders, and elevators. Safety on stairways. Accidents at work frequently happen when climbing between levels, as in stairways. Loose clothing, excessively long pants, or an untied shoelace are just a few of the examples of potentially dangerous and common tripping hazards that cause falls when climbing stairs. Here are some simple tips that should be followed to avoid falls and injuries when climbing and descending stairs. Always watch your step and remain focused while walking on stairs. Ensure your shoes are tied. Proceed one step at a time with a straight posture. Remember to keep to the right side at all times. Use the stairs in single file to avoid collisions with other stair users. Use handrails only to guard against falls, not to pull yourself up or to slide down. Watch for opening doors at landings. Do not gather with others on steps, group up at landings, or within stairwells. If you notice unsafe conditions on steps or in stairways, report them to your supervisor or the proper maintenance staff for immediate repair and correction. Ladder safety. Falls that happen while using ladders are one of the major causes of workplace death and injury. Employees are required to follow safety policies which prohibit climbing on chairs or other objects and the use of unsafe ladders. Always use care when choosing and using a ladder or folding stool. Never allow more than one person on a ladder at a time. Prior to getting on a ladder, always make sure to inspect its condition, including the rungs or steps, latches, and platform. If any area or component of the ladder shows damage, it should be removed from service. Be sure to always wear clean and slip-resistant footwear when using ladders. Do not use a ladder if you feel dizzy or are fatigued. Be conscious of the safety of others working in the same proximity. Select the correct ladder for the task, tall enough to access the work area without standing on the ladder's 2 or 3 highest rungs. And ensure that you understand all operational instructions. Check the ladder's maximum load rating to ensure it can support the combined load of the equipment and your body weight. Ensure the ladder is clean and free of oil, grease, wet paint, or other slipping hazards. Fully open the legs of your ladder, and always engage locking spreaders. Never leave a raised ladder unattended. Fold and store all ladders immediately after using. In addition, be sure to consider the positioning of the ladder required to complete your cleaning task. Be aware of and avoid potential electrical hazards in the work area, doors that could open toward the ladder. Lock, block, or guard those doors as needed. Placing a ladder on any uneven, unclean, or slippery surfaces. Setting up a ladder on any movable object. Examples: pallets, vehicles, tables, or boxes. Standing on the highest rungs of any ladder. Refer to the operating instructions. Placing cleaning supplies, materials, or tools on a ladder which could fall off and hit someone. It is important to always be facing the ladder when climbing or descending. Never step on or off from the side or back of a ladder. Safe positioning includes moving the ladder when necessary so as to prevent the user from leaning too far in any direction away from the ladder in completing their task. This prevents falls from a loss of balance or from tipping the ladder over. Safe use of elevators. While it seems like elevators are a very safe way to access multiple levels, it is important to understand the risks and hazards to avoid, as well as some safety guidelines for their use. You should be knowledgeable about procedures in case the elevator would stall or somehow malfunction. There are also simple and courteous steps that reduce the risk of accidents and injuries to custodial staff and others when observed by all elevator users. Entering and exiting elevator cars are prime opportunities for collisions. Be attentive and remain focused when entering and exiting an elevator. Do not block access to the elevator, and make room for other users. Avoid distractions, like talking on your cell phone when using an elevator, and be conscious of your pathway into and out of the elevator car and lobby areas. Be patient and considerate of other elevator users, and be sure to maintain control of any objects or materials you might be transporting, like a cleaning supply cart. Here are a few other tips for safely moving between floors. When waiting for an elevator, stand a few steps back and to the right of the door. Always allow passengers exiting the elevator to do so before you board. Do not use any body part or piece of equipment to stop the elevator doors from closing. Watch your step when navigating over the elevator threshold. After entering, move away from the door. Stand against the wall, and make use of handrails. Use the operating buttons to hold the door open when needed, or ask others to do so for you. When exiting, be courteous and avoid other users seeking to enter the elevator. Elevator emergency events. Each custodial employee should familiarize himself or herself with the normal and emergency operations of elevators used while on the job. It is not safe to use an elevator during an electrical disturbance or in the event of a fire. Remain calm and utilize the closest stairway exits as indicated. If you should be using an elevator that becomes stalled, here are some things to remember. In the event of a power failure, emergency lighting will come on. Remain calm and ask others to do the same. Never attempt to exit or climb out of an elevator that has stopped between floors. Use the alarm or help buttons, the telephone, or intercom to report your situation. Chemical safety requirements. Without using chemicals, custodians couldn't complete cleaning tasks. Although chemicals are considered hazardous substances and have a number of handling risks, they can be safe for use, storage, and disposal as long as the right precautions are in place. Chemical exposure occurs every day as part of a custodian's job. Because harmful substances may enter the body by being inhaled, ingested, or absorbed, this safety presentation will include ways to reduce chemical exposure in the workplace. SDS, Safety Data Sheet. Custodial staff should become familiar with the SDS, which provides instructions on the proper handling of cleaning substances and chemicals. The safety data sheet will include procedures for working with chemicals, including preparation of cleaning solutions, physical data regarding a product's appearance, the flash point, and impacts on health, safe storage and disposal instructions, cleanup procedures to address chemical spills, first aid instructions to be followed, other precautions, and information. Cleaning chemicals should all include labels with tags and other material available to provide information from the safety data sheet. See your supervisor with any questions about handling chemicals and SDS information at your specific employment location. Custodial staff must demonstrate thorough understanding of safety data sheet information to ensure their own safety and the safety of other employees. Safety working with chemicals. We have already discussed the importance of using personal protective equipment. Chemical safety requires protection using gloves, goggles, and special clothing to avoid skin contact, as well as contact with the eyes and face. Gloves and other PPE must be inspected and replaced if there are signs of potential failure or degradation. Other protective measures include using only chemicals authorized for the correct purpose and in the appropriate manner, having a thorough understanding of the dangers and safety procedures, frequent review of the SDS, cleaning product labels and instructions, proper solution preparation and labeling of containers, using accuracy and caution in measuring and mixing chemicals, never using unlabeled containers or bottles of chemicals, routine and thorough industrial hygiene practices before and after handling chemicals, properly storing and disposing of cleaning solutions and chemicals. Dilution is the process of making a substance less concentrated by adding a solvent, such as water. Proper dilution is critical. Many facilities now use auto-dispensing systems that automatically mix the chemicals with water. A dilution control dispensing system is designed to automatically mix concentrates with water, after which it is dispensed into secondary containers such as spray bottles and mop buckets, or equipment such as carpet cleaners, auto scrubbers, or foam applicators, all the while never exposing workers to the chemical. Using the system will improve safety by eliminating chemical exposure, but it will also take the guesswork out of diluting chemicals. At the push of a button, precise amounts of concentrates are diluted. The system is very simple to use. Turn the water on, turn the dial to the chemical you want to use, then fill your flat mop reservoir, floor machine, or spray bottle. The concentrate bottle label color closely matches the chemical color and spray bottle label, so there is no confusion. Using a chemical dispensing system has improved safety. Chemicals are fully contained, and the threat of exposure has been eliminated. It also helps to ensure the products are diluted properly. It will help to prevent the release of potentially harmful fumes, which is common when chemicals are mixed manually, and eliminate waste, thus reducing costs. Custodian staff should be familiar with the emergency steps to follow if chemical exposure occurs, including safe and hygienic industrial safety measures. Procedures are to be strictly followed, and managers notified promptly of accidents involving exposures, spills, or splashes of chemicals affecting any employees. Emergency procedures vary depending on the nature of the chemical contact. For chemical contact with skin, immediately wash the exposed area with water for 15 minutes and a mild soap, if available. Medical attention must be obtained, especially to treat any irritation that may develop. Clothing must be laundered before it may be reused. Shoes should also receive thorough cleaning before additional use. For chemical contact with face and eyes, immediately use water to flush the affected areas for 15 minutes and obtain medical attention. Any PPE exposed should be thoroughly cleaned before reusing or disposed of and replaced. If chemicals are ingested or swallowed, rinse mouth with plenty of water and seek medical attention for irritation and other symptoms. Proper storage and disposal of chemicals and their containers are part of company safety policies. Important safety for all storage of chemicals includes double-checking to ensure lids are firmly closed on all chemical bottles, returning all cleaning bottles and supplies to the storage closet promptly at the end of your shift or when cleaning tasks are completed. Only storing chemicals in their original containers, with labels intact. Discarding any unused chemicals, including information from safety data sheets. Never storing chemicals in areas used for food storage, and never consuming meals or beverages in areas where chemicals are commonly located. Always storing chemicals away from heat sources and direct sunlight with adequate ventilation. Keeping stored chemicals on shelves lower than eye level and neatly organized. Inspecting shelves and bins in chemical storage areas and making necessary repairs immediately. Ensuring chemicals are never stored with flammable materials. Immediately reporting any chemical storage issue to your supervisor for correction. When you see a spill or an object on the floor that doesn't belong there, mop or pick it up immediately. When cleanup involves blood-borne pathogens on floor surfaces, you should first mark the spill area so others do not enter the area until cleanup is complete. Blood-borne pathogens are infectious microorganisms in human blood that can cause disease in humans. Blood is a major source of bodily fluid contamination. These pathogens include, but are not limited to, hepatitis B, HBV, hepatitis C, HCV, and human immunodeficiency virus, HIV. Needles and other sharp objects may expose workers to blood-borne pathogens. First, collect your equipment and chemicals. You will need disinfectant cleaner, PPE, paper towels, and a disposal container. Next, wash your hands with hand soap and put on your PPE. Then spray the approved disinfectant on and around the spill. Follow the label directions. Apply disinfectant liberally and keep the spill wet for the time specified. Contain the spill. Cover the spill and disinfectant with an absorbent material like a paper towel. This prevents splattering or spreading of the spill. After the fluid has soaked into the towel, gather the decontaminated material and dispose of according to your facility's blood-borne pathogen procedures. Spray the spill area again with the approved disinfectant. Follow the directions on the label. Let the disinfectant work for the specified amount of time. Dispose of any decontaminated material and personal protective equipment by following the guidelines in your facility's blood-borne pathogen procedures. Wash your hands with hand soap. Hand washing is the most important precaution against spreading infection. Workplace electrical hazards. Another workplace risk encountered by custodial staff is hazards that are electrical in nature. Always obey the procedures for electrical safety when using any equipment supplied by electric power. Be cautious. Take your time. And be sure to fully understand instructions as to how to operate any tools or equipment before beginning your task. Consider these tips as you prepare. Always use the required PPE. Never handle electrical plugs or electrical equipment with wet hands. Inspect the power cords and equipment for wear and damage issues prior to use. Cords should not be yanked from outlets. Remove by holding the plug close to the outlet. Operators must be trained and authorized to operate electrical equipment. Never carry power tools by cords or hoses. Carefully coil and store cords to avoid damaging wires. Turn off and unplug equipment when not in use, even for short periods of time. Ensure cords or electrical equipment do not create hazards for tripping. Utilize ground fault circuit interrupters, or GFCIs. Extension cords must be carefully placed to avoid creating hazards or damaging the cord itself. Report any equipment damage and needed repairs immediately. Report any electrical injury immediately. Preventing workplace fires. Fires in the workplace generally have causes related to electricity, chemicals, and employee carelessness. The best fire safety prevention is proper housekeeping practices, along with emergency fire management procedures. While all fires may not be preventable, the damages they cause can be limited. As previously mentioned, proper storage of chemicals and maintenance of electrical equipment can prevent accidents and injuries. In addition, they can reduce the likelihood of fire. Certain materials are very flammable and easily combustible. They burn quickly and are easily ignited. Important safety areas for fire prevention in the workplace include reporting and repairing damaged or frayed electrical cords, plugs, and outlets. Investigating signs of potential danger, a burning smell, for example. Not using damaged equipment that could cause an electrical shock or fire. Limiting quantities of dangerous substances like combustible liquids. Using the least hazardous chemical available. Proper storage of flammable or combustible materials using original containers with securely tightened caps. Storing dangerous materials on lower shelves away from direct sunlight and heat sources with lots of ventilation, and using safety rooms and approved cabinets. Workplace emergencies. Despite OSHA regulations and the efforts of employers, 4 million workers sustained serious injury annually and more than 4,500 deaths happen each year in the workplace. Here's what to do when you're at work and need to evacuate your workstation in the event of a fire or other emergency. Do not panic. Stay calm. Stop what you're doing and quickly secure or stow any equipment or tools safely away. Avoid blocking exits in any way. Do not use elevators during a fire, flood, explosion, or electrical power outage. Wait until emergency lighting is illuminated, and locate the nearest exit. Walk, do not run, to the exit and evacuate the building. Go outside to the designated safety areas and meet the rest of the staff. Consult your supervisor. In the case of a medical emergency or injury, stay with the affected person and ask another worker to call 911 for help, or call 911 from the nearest phone, keeping in sight of the injured person if possible. If trapped in a stalled or disabled elevator, use the emergency button to call for help. Explain your situation and calmly wait for help to arrive. Importance of hand washing. As a reminder, your role as custodian puts you in frequent contact with microorganisms and chemicals, so please wash your hands as often as possible as you complete your job duties and cleaning tasks. Your personal health and safety is important. Maintaining a high level of personal industrial hygiene is a benefit to you, other employees, and our organization. It will help you avoid illness and further promote safety in our workplace. Employee safety training. All employees receive periodic training and training reviews on safety procedures and policies. Employees will be notified when updates and changes are made to workplace safety documents or rules. Retraining may be required following a work-related accident or injury when unsafe behaviors are observed or if additional safety needs arise. Help prevent workplace accidents. Most accidents are caused by someone's actions. They don't just happen. That means they might be prevented if we all remember to use caution and safety as we complete our jobs. Be careful and encourage others to do the same. This presentation covered the very important safety aspects for your custodial position. Please do not hesitate to contact your supervisor if you have any safety-related questions or concerns.